Right. I'll call you in a bit. All right. Bye. Sorry.
All right. Good morning or afternoon. We're on to, Melanie, can you do roll call, please?
Commissioner Turnbull,
Good afternoon, present.
Commissioner Chamberlain,
Present.
Commissioner Mapes.
Here.
Commissioner Van Alstine,
Here.
all present.
Approval of the agenda.
I'll make the motion.
I'll second.
Motion by Jonathan, seconded by Mapes. Do we need to roll call or just all in favor?
Aye.
Aye.
All opposed? Public comment? No public comment. Discussion, bylaw discussion. Would like to open up?
Well, I guess I can start and just kind of give you a little bit of history. So back a few years ago when I took over as interim health officer and then later health officer, that the board, I think it was 2 boards ago, started looking at bylaws, and we were meeting somewhat regularly, once every couple months. And there was a little bit of, going through each section. But it just kind of fizzled out, and there was not a lot of, I guess, consensus on what way to move forward. And then I think the last board, it was just kind of decided that, the bylaws, they're not perfect, but they work for right now, and recognizing that there's some things that, should be changed in them, but wasn't a priority. Okay. So, I think, Terry asked that, we put this on the agenda just to basically, again, start looking at them, maybe update them to something that's a little bit more relevant to today. And this would not be like a one and done, this is going to take time, and I think, and I did send you some examples, some from some other health departments about what their bylaws look like. And they're all, even though they're similar, they all have their own little twist and differences. And, I know probably you haven't had a whole lot of chance to even look at those, but I don't know if anybody, if you all have ideas about what you'd like to see.
What would you like to see?
Well, that's a good question. I think,
What do you think needs changing? I can see a couple things, but.
right. I think when I look at these, we just went through this over at Benzie Leonard last year and made some changes. And that was kind of like the one that I was involved with. Okay. And some of the things, it's really was board driven. And they just wanted to, basically put some information in there about what the role of a Board of Health member is. And that's really was the major change that was put in there. And they also wanted to put some things in there about attendance and things of that nature. But that was the major thing, because I think, during when COVID blew up, and things were happening, there was some Board of Health members over there that were like, well, what exactly is our role in this? We have all these things going on. And there wasn't a whole lot of understanding between and I think everybody understands it better now, but there was not a lot of understanding between, the authority of the health officer versus the role of the Board of Health and where the differences are, right? And what the Board of Health can do and what the health officer can do, and how those, how they interact together, So that was some of the work that was put in there. So the idea was if you're a brand new Board of Health member, if you're looking at the bylaws, you would have some understanding about, what your role is being on the Board of Health. So, that kind of makes, I think maybe some of those additions would make sense to me. I mean, I know, you know, I'm sure you guys have some ideas too.
Jerry?
On Benzie Leelanau's bylaws, on section 3 and the meetings, we do not have in our bylaws the order and decorum statement, which I thought fit very well. That would help with clearing up if a person from the public was throwing darts per se at a board member, that the chair can stop that and do that as we have it by Robert's Rules of Order. You're allowed to do that already, but this spells it out in
Yeah.
writing, so there's no question. Also, and I didn't really see any of them that had it. Our Board of Commissioners did a kind of like a purpose of the board, what our actual responsibility is to the health department, and what our goals are for that. And I'd like to see something like that added, and let Dan put something together to bring back to us to look at, because it really doesn't say if you're a new board member, or either way, you really don't see anything in there that says what our purpose is. Do we have a direct purpose of what we want to do, what we can do? I mean, really, the board is basically holds policy and budget. That's about our only decisions. Everything else is up to the health director. So I would like to see if we could draft something like that and have it back. I don't know what the feeling of the board is, but that's a couple things that I seen that stuck out to me that we really don't have in our bylaws.
Yeah, I think that's a good observation. You know, another thing that's in our bylaws currently is the charges for the committees. So like one of them, just for example, under Personnel and Finance Committee, it says review all staff evaluations. I don't think the Personnel and Finance Committee wants to review all staff evaluations. So that doesn't even make sense
Yeah,
that
that popped out at me when I was
that's
reading
in
it.
there. And they don't really, you know, the Personnel and Finance Committee doesn't really develop the agency budget. They review the agency budget. But development of the agency budget is on the leadership staff at the health department, and then is brought to the committee to review and ask questions and whatnot. Same thing with the development of, or develop appropriations and allocations recommendations. It's more of a review. So yeah, I mean, there could be some things under the committee charges that could be updated, I think. And if if you would like, I could kind of put together a list and for the next time we have this meeting.
Yeah.
And then everybody can take a look at it, and we'll make sure to get it out ahead of time and whatnot. And kind of along with like the purpose and or goals of the Board of Health, and, you know, membership in the Board of Health, as Terry suggested. So I will put that down as a to-do on my side.
I read over the other bylaws before I read our current one,
Mhm.
and I'm still struck by, it seems like it's easier reading to read the other ones than it is ours.
Anyone particular?
No, because they all had distinctions. None of them were the same. They're all different, you know, and that's because of the people who formulated the bylaws. They all range from like 3 to 5 pages, I believe.
Mhm.
you
I
know.
think the shortest one is 3 and the longest one is 5 or 6. But that's for a 10-county board too, I think the biggest one. But they all pretty much say the same thing, but they just word it a little bit different. But I agree with yours too, that on that personnel and finance committee, I think one of the things that we had an issue with when in our first meeting or two was grants. You know, we were gonna do something, you know, for the program and evaluation committee regarding grants.
Which we did.
We did get that finished?
Yep.
Yep.
Yeah.
No, we did, yes. We did do that.
I mean, one of them, like the LMAS, District Health Department, they have procedure for Board of Health meetings. You know, which I don't know if we want to look at any of that. And I'm wondering if any of the, anything needs to be updated with like the legal authority and things of that nature. Of course, anything that we did differently, I would have our attorney look at.
Yeah.
Yeah, just to make sure it's, you know, it's right.
Could we, when you do that, could we, this is the only board I've ever sat on that doesn't approve the agenda.
Well, so we used to do that. And then we changed it based on our attorney's advice. I think that was in May, because we had a meeting where we couldn't agree on the agenda.
Yeah.
And then basically we didn't have a meeting, if you recall.
Yeah.
And so we did a lot of work kind of trying to figure out, okay, what do we need to do to make sure that doesn't happen again? And our attorney, working with a parliamentarian, came up with our current agenda format. And it was the add or removed agenda items, because there's nothing in the OMA, the Open Meetings Act, that requires that you approve an agenda. It's basically silent on that. So the idea was the add or remove items from an agenda. Like if a commissioner wanted to add anything or remove anything, it would be individually. So it wouldn't necessarily tie up the whole agenda. Like if you didn't approve an agenda as a whole, like those would be taken individually. So if you wanted to add something, it would be taken individually and then it would be voted on by the board. And on the flip side, if you wanted to remove something, it would be individually and voted by the board, you know, up or down. And it didn't encumber the entire agenda. And that was the reasoning behind
Okay,
that.
just I haven't been on another board yet that you don't
Right.
approve the agenda. I
Right.
mean, no place, even like townships and villages and everybody, it's.
Right.
You approve the agenda and then you move forward, so.
I agree.
It was just weird to me that we don't do that. I mean,
It
Additions-
essentially is approving, like that part is essentially approving the agenda or
Okay.
not.
but they're just not making that motion to approve the agenda,
Right.
basically.
Which my understanding is
It
it's
would
not
imply.
right. And my understanding is it's not required by the Open Meetings Act. So yeah, trust me. And we paid a lot of money for that opinion.
Yeah.
So
I understand. I'm okay with it. It's just that it's weird that nobody else does it that way.
I know it is weird. And actually, when I talked to the parliamentarian myself about it, about that fact, like, you know, every meeting I've ever been to, they have, you know, approved the agenda on the agenda. And she said, yeah, I know it drives me crazy because it's not required, but everybody does it.
Yeah.
So I
Okay.
don't know. And I can, you know, if you'd like, I could share that.
Your word's as good as
The-
gold. I don't need any more than. that.
Okay. All right.
Anything else you guys want to talk about? We'll save it for next meeting. Look at the changes.
So I guess what I'm hearing is you'd like me to put together maybe a draft,
Yeah,
you know,
Yeah, put-
bylaws, like what things I think should be changed, and I can put them in strikeout, you know, what's there, and then add what you know,
And put the ads in like.
a different color or
gold
something.
Yeah.
and or some- Yeah.
Yeah,
Red.
so it's, so you can see what
Right.
was what was
Yeah.
removed and what was added. Okay.
Yeah, that'd be nice having like a mission state, whatever, in there. It'd be good.
Yeah, no, I can do that.
All right, I guess we will move on to the Michigan Office of Highway Safety Planning Seatbelt Grant.
Okay, so, this came from actually, an individual from the Michigan State Police, this Office of Highway Safety Planning that's housed within the Michigan State Police. And they reached out to us because Otsego County, was below 90% for seatbelt usage. So they reached out and said, hey, just want to let you know, that Otsego County is within your jurisdiction. We found that, it's below 90% and we're reaching out to every, a health department that has a county that fits this criteria and just letting you know that we have these grants available if you want to, work on a project to help fix that situation. And other issues surrounding, like teen driving and distracted driving and just all those things that have to do with, safety, in a vehicle. So, one of our staff members, Ellen Templeton, which I believe, you've heard from before, she put together, the grant application review form, put all the information in there and just basically, laid out, what kind, applying for this grant, what we would apply for, like what kind of project it would be. And it would more or less, fit in with our, RISE, coalition, which we all, do a lot of work with that, or they do a lot of work with that. Using the, Otsego County Teens, it's basically like a youth-led, initiative. So, if you recall, we did some things on, vaping and, they just do all kinds of great work with, substance use prevention through that group. So this would fit in well, in that coalition to basically involve youth to come up with a campaign to, increase seatbelt use, talk about the dangers of distracted and impaired driving, with the idea that we would greatly reduce accident rates among young drivers because, in that age group of 16 to 17 years of age, the crash involvement rate is 14.8%. And then, if you're looking at 45 to 64-year-olds, it's 5.4%. So, I mean, it's much higher in that group. As you can imagine, inexperience, distracted driving, impaired driving. And then also, seatbelt use is important in those situations as well. So,
Dan, would that be given to the drivers training people too? In other words, would there be some kind of like a brochure that the drivers training instructor, when they're doing their driving part of their test, that they would get a piece of paper of some, like a little back card or something that has that information on it? Could that be added into this to do that with?
I think it probably could be. Yeah. I don't see any reason why.
That's where you hit the 16 and,
Right.
15 and 16-year-olds is right up front, when they're taking their driver's test. And everybody's got to have one. So you got a captive audience right then.
Oh, yeah, exactly. Yeah. Trust me. My youngest son has just started driver's training last night. So.
Your wallet's a little bit lighter than.
Yeah. Yeah. When I was in high school, it was free. Like the teachers taught it, which I understand they're trying to bring back,
Yeah, they
but,
are.
That's a good thing.
yeah.
And
But
why
yeah.
If I may, Mr. Chair, why did the state police reach out to HDNW to do this, and why aren't they doing it, applying for the grant?
These are grants that they make available to others. It's not something that they do the work in. they just make the funding available to others to do projects within their jurisdiction. I think it probably has to do with, they don't want to, they would rather do it that way than staff people to do work, in all
Yeah, it
those
just seems like
jurisdictions
it's the-
statewide.
It's within the role and responsibility of the police department. And it'd be nice to have Scott Hankins here. with guys can-
Yeah.
But, it seems like, I mean, we're, biting off a piece of their pie. Well, I mean, it sounds like they're trying to make us take over doing this.
Well, I mean, it is.
Unique.
Yeah. I mean, it does fit within the scope of what the health department does because it's prevention.
Mhm.
And I think, by tying it in with RISE, we already have a group that is convened regarding substance use prevention. This, teenagers are notoriously inexperienced drivers. They, trust me, I pay car insurance for 2 teenage drivers right now, soon to be a
Mhm.
third one. And yeah, it's a lot more than it is for like my wife and I. So yeah, I think, the reason, I don't know the reason why that office wants to do this work through grants, but I just know that they reached out to us. They encouraged us to apply for one of these grants.
Okay, and
to-
where's the grant coming from?
It's coming from
Michigan State Police or?
Office of Highway Safety Planning, which is housed within the state police, which the Office of Highway Safety Planning utilizes federal funding from the National Highway Traffic Safety Administration to award this grant. So ultimately, it's federal funding that
Mhm.
is going to the state that is then being passed down to locals.
It's ironic. I sit on a board with the Michigan State Police and they're always talking about how they need more funding and they don't have enough for this or that, and yet they're handing it out. It's ironic, I suppose.
Yeah, and it could be.
I'll beat them up about it. It'll be fun.
Yeah, it could be too that it's just the way that the funding is earmarked from the federal government, that it can't be used for direct operations from the state police. I mean, sometimes, we've talked about this before, different sources of funding have different restrictions. And that could be the reason that they're not doing it, themselves, they may have a mandate that this amount of funding needs to be available.
Is Helen here? Or Mrs. Templeton?
No, she's not here. No.
So I'd like to, I mean, if we move forward with this, I would like to talk to her and I'll probably give her a call later because RISE, for all of its, good intentions, talked to quite a few kids within a high school and none of them know about RISE or, well, not none of them, but very few of them have ever even heard of it. I mean, they know about the programs that are going on. So at least there are programs and they know of the programs. But it might be something we move forward with it, like they will have to talk with them about making sure they get their marketing, their ability to market. Something we'll have to
That's a
look at.
good point. And they may recognize, like you said, they recognize the programs, and it could be that they're not specifically saying that it's from RISE, but it's just something more that's being recognized by.
Yeah, it'd just be interesting because
youth.
I don't know. I mean, it is interesting that our health department is taking it on because I know when I was doing driver's training, I mean, a few years ago, but still, a police officer came to me and was like, hey, if you speed, you pull over and you get a ticket. If you don't wear your seatbelt, you're getting pulled over and get a ticket. If the health department was like, they tell me anything, I'd be like, huh? Why is this coming from you guys? So it's definitely interesting.
Yeah, and maybe it's just a different way to try to get the message through, and especially to teen drivers. I mean, that's really what this is focusing on.
Will the state police have a hand in this at all, or is it just their funding?
Well, it's their funding, but there will certainly be reporting back to the Office of Highway Safety Planning, which would be laid out in the grant RFP. And I have not looked at, exactly what it says about that, but every grant that we are involved with, literally, you have to do quarterly reports at the bare minimum.
Said on the
Yeah, one of my
surface
fears is, I mean, state
Yeah.
police,
Yeah.
police just in general have their programs and policies and their methods of getting at, these issues. I would hate for us to have to, reinvent the wheel, so to speak, where, if we do this, like, hey, what has worked, what hasn't worked, and then we can do that. So it'd be interesting to see if they have a heavy hand in it or not, but that's all I have. Mr. Chair.
Okay,
Dan,
Kathleen?
can you hear me?
Oh, yeah. Do you want to say something, Holly?
Yeah. Oh, I'm so glad you guys can hear me now. I think that one of the reasons, that we're often asked to take up these grants or to apply because we're so good at providing the education that maybe the police don't have the bandwidth to do. That's why they're giving out money. And, public safety and public health really go hand in hand. So seat belts, helmets, crosswalks, stoplights, all of those things. That's all related to public health because at the end of the day, we want people to be safe. We don't want them getting injured. We want people to be able to live their lives in a way that they don't need help from others, right? And them wearing their seatbelt is a prime example. So, I don't think that the police is necessarily wanting to like offload this on us, but I think that they know that we do such a great job and have such good relationships with youth already that it's just like a natural fit to collaborate with them in an effort that really does align with what the health department does.
Thank you, Holly. And I will say too that the Michigan State Police do sit on the RISE board coalition. I'm sorry, I called it a board, but it's really a coalition. So we already do, I mean, not only them, but I believe the sheriff's department does too as well, don't they? Yeah.
And I think the work plan would have, that's going to have input from the police department too, like that's going to be a collaborative effort. And they'll be able to tell us what has worked and what hasn't worked or what they're looking for us to do. Ellen, she is a health educator. That is what she does. And that covers a wide scope of different topics. And, the work plan would definitely be something that they would have to approve first.
And how much is the grant, Dan?
So we would be asking for $50,000, of which $10,000 would be dedicated to media outreach. And that could be, billboard or like a PSA spot on the radio or, a television ad.
Would we be hiring any new employees?
No, we would be absorbing that in our current, staffing, and it would be, basically for the fiscal year of 2025, which would begin August 1st. I mean, October 1st, not August 1st, October 1st, 2024, and run through September 30th, 2025. It would be equivalent to 0.23 position, which we have the capacity in community health right now to absorb that, to do that work.
I think too, we have the new digital content specialist at we had shifted a publishing specialist in-house to a digital content specialist. And she really is an expert and would be driving a lot of that marketing line item to get out to, youth and really target that. She has some expertise in different things that I'm not as familiar with, but geofencing and, can really use analytics from the internet and different social media platforms to target the youth.
Rise is at the movie theater over there too. You guys do some really nice ads.
At the movie theater. Yeah. Yeah.
I always compare RISE to my area's SAFE program and,
Yeah.
you know,
Yeah.
I kind of laugh when I hear people they say, I don't know what it is. I said, "There, geez, come to a basketball game in the winter when they do this big safe program, handing out hats, everything, brochures to all the kids. It's great to see. And I still have my safe hat at home.
All right.
So I think it's kudos to do this with the kids. I think that's the group you need to focus on.
Yeah, and really, to read from the summary, what the project would be is to engage in the promotion of safe driving among youth, aim to involve local teens in creating public service announcements. So not only, they would be involved with that work, which is kind of key to what RISE does is everything that they do, they involve the teenagers that are, this impacts to get their perspective, which I think that's why it makes it very effective. Because they're talking to their peers. But the focus would be on educating young drivers in Otsego County, along with their families and the broader community, really, on proper seatbelt usage. And then also, like I said, the distracted driving piece and impaired driving is going to be a big part of that. And I like the information, like you said, Terry, about giving information to the driving schools.
You got a captive audience right then.
Yeah.
Right.
Yeah.
I like teaching a kid to always brush his teeth, take a bath, do the stuff. Now they're at the age, teach them always put that seatbelt on.
So do we need a motion on this to move to the full board?
Yes, we do.
Yeah, I'll make the motion that I recommend we bring this before the full board at the next meeting.
Is there a
I'll
second?
second it.
We do a roll call vote?
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mapes,
Yes.
Commissioner Turnbull,
Yes.
motion passed.
Thank you.
So is there going to be a deadline on this? I'm reading March 5th, 2024.
March 15th is the deadline for the application. So we will apply, of course, at the full board, if the full board decides that, differently, then
We just turn it
we
down.
just,
Pull it up.
right. Right.
All right. I guess we can move to adjournment.
I'll make that motion.
All right. Right, I call us adjourned. That's
Okay.
what we always used to do. There.
There you got to use the gavel again
to use
and
the
you did hit yourself in the head.
One last snack. Thank you.